Welcome, everybody. And today we're going to be talking about the role of Chief Medical Information Officer in making the transition to telehealth, specifically having to make a quick transition to telehealth. And to discuss this topic, I'm really excited to have Alison Connelly-Flores with us. She's a certified physician assistant, and she's also the Chief Medical Information Officer at Urban Health Plan, Inc. in New York City. She has extensive accomplishments in implementing information technology, operations, change management, driving quality initiatives, and initiating programs that foster best practices and patient satisfaction. Not only that, she's also a provider in the infectious disease clinic. So, Alison, I'm really excited to have you with us today, and thank you very much for joining us.
Thank you.
Yeah, so New York City, where you work was, in the United States anyways, one of the first places to get hit pretty hard with COVID-19, which, created the necessity to quickly shift to telehealth. So I was wondering, can you kind of explain a little bit how you got started in telehealth as the Chief Information Medical Officer?
Sure. So yes, as you mentioned, New York City, particularly the areas we serve, were hit particularly hard by COVID. We had been discussing getting into telehealth for several years, but unfortunately reimbursement just wasn't where it needed to be to facilitate us doing that. We weren't able to get reimbursed as a federally qualified health center in the city as they did for rural health centers. So we were really, as you mentioned, thrust into telemedicine virtually overnight when COVID hit back in March. So within about a week, we had to get about 225 providers doing telemedicine visits and support staff, get them up and running, doing telehealth. And we needed to do it that quickly to deal with the crisis at hand, and also to be able to deal with our patients and to be able to remain financially viable.
Wow, that is incredible. So was telehealth not really something you were working on implementing yet? And then all of a sudden, within a week, you would have put the pieces together to launch?
Correct. So we had been planning it. We had been testing different platforms. We had been starting to develop policies and procedures, but none of our computers had monitors. None of our monitors had cameras or mics. Our bandwidth was not the best in all of our facilities. So we had to really make do literally with what we had. So most of the providers were using their own cell phones to conduct the telehealth visits. We got a platform that was very quick and easy to implement, and we rolled that out as quickly as we could.
Excellent. Yeah, and then your patients were able to make that transition. They had technology-wise, what they needed to get the healthcare that they needed?
Well, it was also a challenge for our patients. Many of our patients don't have technology to be able to do a virtual visit. So in many cases, we had to convert the visit just to a telephone-only visit. So we did that for every case it was appropriate, or if the patient just didn't have the technology to do it. In some cases, depending on the evaluation over the phone, they would have to come in person, but wherever possible, we tried to keep them out of the facility.
Yeah, so in your role specifically as Chief Medical Information Officer, you handle the IT, right? The information technology. So your role specifically, what were your responsibilities, and what was on your plate in terms of making that decision? And what other roles did you partner with to accomplish this task?
Sure. So my initial role was to find a product that could meet our needs, like I said, basically overnight, something that was easy to attain, easy to deploy, and easy to train on. So we did find a platform. I also had to create templates very quickly with consent built into them, so providers would know what to discuss with the patients from a consent standpoint, and also the different billing codes, like the modifiers that are used to differentiate if it's the type of visit. And then
even though you're the IT, right?
Yes.
Yeah, you still had to play a part part in figuring out the reimbursement aspect to it.
Correct. I was involved with that, and I worked with our practice management team to make sure we were doing it correctly, reading the regulations and making sure everything we did was appropriate and accurate. So we also had to build different templates if it was a telephone only visit, because those CPT codes are different, and we wanted to make sure our documentation was appropriate. Sure to include the amount of time that the provider spent with the patient, and just to make sure everything was done.
Right. So you really wore multiple hats. So rather than just doing the IT, which is, do we have the tech right necessary, you also held a little bit of the compliancy officer with the forms and the reimbursement piece. So you wore multiple hats.
Yeah, and I think it's important in my role because I also see patients. Before I decided to roll this out, I tried seeing a patient with it to make sure it was easy from the patient perspective, to make sure it was good from the provider standpoint, to make sure the video quality was good, and the platform was easy enough to use. So I think it helps that I'm in the IT role, but I also see patients. So anything I'm asking others to do, I have to do myself.
Well, hats off to you for accomplishing that. That's a huge, huge task. Like we have a telehealth director, manager, coordinator training program, and usually, the process to putting it together is so much that comes into play. And you did those things of, working with those that are involved, getting feedback, the policies and procedures, the billing, the technology, the workflow, and so forth, and getting people what they needed in their hands to make it happen. That is quite significant. You probably took a big deep breath when that was finished.
Definitely did.
You probably worked a lot of extra hours during that week, I would imagine. Wow.
That's correct.
Yeah. So, in your position, are there other key roles within your organization that you're tightly partnered with in accomplishing these kind of tasks?
Yeah, so obviously I look at my position as a liaison between the IT department and also the medical department. So I sort of bridge the gap between those two areas. So I am not trained formally in IT, but I have to understand obviously how the products work and the impact they'll have on our overall systems. So I do get involved in that, and I also have to relay the concerns and needs of the medical staff and the medical providers to the IT department to make sure we can accomplish what we need to be able to support our patients and provide the care that we need to provide.
I see. Yes. Yeah. Very interesting. It sounds like a very fulfilling position. Really, interesting position where you're able to, hear from both sides and kind of see the operations in you see multiple aspects of the operations. So being that this is a new launch for you all, how did your patients take it? Did they find it helpful? Were they able to transition?
Yeah, so I think telehealth has really been a lifeline for our patients. They're very, very appreciative that there was no lapse in their patient care, that we were able to quickly transition from an in-person visit to a virtual visit. We also conduct daily patient satisfaction surveys, and the feedback we've gotten has been overwhelmingly positive on this process. I think one of the other things I think that helped with the transition is we really tried to educate patients as much as possible. So we changed the litany in our call center. I also sent out blast text messages to our patients about what to expect, with a link to the video platform in the language of their preference. So to our Spanish-speaking patients, we sent the text and the video in Spanish, and for our English patients in English. And I think that was very helpful to be able to, this was new for them too, right? So just teaching them and setting expectations and what they could expect and what the visit would be like. We continued also, of course, to have our sites open in case there were any acute issues that arose where the patients needed to be seen in person. So we also outreach to our most vulnerable patients to make sure that they had all the medication they needed. So if there were patients with multiple chronic illnesses that maybe hadn't been seen for several months before COVID, we actively outreach to them to make sure they had all the medication they need, to see if they had any needs that weren't being met, just to make sure that nobody slipped through the cracks.
Yeah. And in terms of your satisfaction surveys, I'm curious, does everyone get that, or is it just you just do a sampling, and how do they conduct? How do you conduct those surveys? Is it a separate service, or is it built into the patient portal, or how does that work?
So we use a separate service. We do two things. One, we use a separate service, a third party that samples a subset of our patients that are seen on a daily basis.
Okay.
So they can call them and obtain quantitative and qualitative data. In addition, after the visit, we send a text message saying, what could we have done better today? So it's just a free form, and patients are able to comment about what they would have, if there was something that they would have liked to have done that was different from what they received.
Right. Yeah. And, the fact that you're doing text on phone really overcomes a lot of access issues where, if it's not done by text, I would imagine your utilization of those surveys and people not getting the information that they need wouldn't be there.
I agree. I think people, we live in a text world now. I think people prefer many times to communicate via text, even rather than by phone. So I found it a very, very effective means of communication. As a matter of fact, I found it so effective. I mean, we probably sent a little over 200,000 texts since the beginning of March. And the response has been so overwhelmingly positive that any of the telehealth platforms that we've considered moving to, one of the prerequisites is that they have texting ability. So it's really very, very, I think, critical, mission critical to doing business now.
Right. And I would imagine those that attended the telehealth sessions, the majority used mobile phones for that.
That's correct.
What would your estimation be on that, or did you get any results on that?
I don't have an exact number, but I'm going to call it the overwhelming majority of virtual visits were done using a smartphone.
Sure. And then it sounds like a lot of the sessions are just done over the phone because there's really not a need to actually lay eyes on a person in a lot of the situations.
Actually, it's not even a lack of need, because I think it's always better if you could see the person. So we always want the provider to do a video visit if possible. Unfortunately, probably 40% of our patients just don't have access to technology capable of doing a video visit. So we had to adapt.
Yeah, right.
So yeah, unfortunately, it just wasn't an option for them.
They just didn't have it.
They just don't have a smartphone. Either there's a flip phone or just a landline.
Okay. All right. Yeah. Hopefully things will, evolve in that regard.
Correct.
Yeah. So that's great that you've been doing the surveys. So now that you've done the surveys and you launched, a lot of organizations had to do the same thing that you had to do. They had to quickly launch, and now that they launched, now they're able to step back a little bit and say, okay, now what are some quality improvements we want to make? And having those surveys is probably really helpful with that. What did you learn from the process, and what can you recommend to other organizations?
Sure. So, like I mentioned, I think we did have challenges, including a lack of equipment, our bandwidth issues at some of the site, and wireless abilities were sometimes limited. Fortunately, we received grant funding from the FCC grant that will help cover a lot of those things. So we have since replaced all of our monitors at all of our facilities with ones that have cameras and mics built in. As I mentioned, one of the other biggest limits in terms of was patient limitations. So just not having the technology available to do anything but a telephone visit. So we have had to do that. I think some of the other challenges are really doing a very proactive pre-visit planning, maybe even more so than before. Because of the social distancing requirements, we still have to limit the number of patients that physically come into the center. So looking ahead to next week and seeing which patients you need to see in person, which patients can be safely done remotely, and having to adjust templates to accommodate both in-person visits and virtual visits while maintaining the social distancing requirements and space limitations that we have. So,
Yeah, so you're doing some like triaging of those that need to come in and those that don't.
Correct.
Trying to
And
do
I
it
think
with health.
one other thing I would add is another one of our big challenges was being able to replicate our in-person workflow. So obviously the workflow is going to be different because it's done via telehealth, but we didn't want to miss any of the important screenings that we perform on our patients in regard to nutrition or social determinants of health. So we wanted the patient experience to mirror as much as possible our in-office session. So it's taken some time and coordination to try to figure that out. And like I said, by looking for different platforms, I think we found one that really is going to help facilitate warm handoffs between different care team members. So so the medical assistant can start the visit, they could pass the patient off to me, I could pass it back off to them so they're able to do the discharge. If they need to see a nutritionist or the clinical pharmacist, they could facilitate those handoffs much more easily.
Yeah, that's so important, that care coordination and warm handoffs and people having access to the patient information when they need it, and so people aren't falling between the cracks. And yeah, great. I'm glad you found a platform for that. So what you just went through, right? Making that transition had to be incredibly stressful because it was stressful for everyone, even those not in your position. So how did you cope? What were kind of your self-care strategies? How did you manage, yourself through that process?
Sure. So for me, I think exercise and eating right has been really key. I also would make it a point to get outside. I feel like I've been sitting at my desk, or I sit at my desk about 12 hours a day. So before I start the day, I take my dog for a walk, a couple of miles, and at night I'll take him for a walk for a couple of hours, and then, a couple of miles. And then I also think cardiac workout, a pretty intense cardiac workout, is helpful just to reduce my stress level and anxiety level, which has been heightened.
Yeah. I do the same thing. I don't do the same thing. I do the walks. So I walk twice a day, like you do, once in the morning before everyone else is up, and then once probably around 3:30 or something. But I don't do the intensive exercise. I skipped that part. But just getting outside is so important.
I agree.
Yeah, excellent. I really appreciate your time. This has been really helpful. And maybe just one other thing that people would really like to hear is, what do you find unique or really incredibly, interesting, or that you really like about your position as Chief Medical Information Officer?
So it may not be unique, I guess, to my field, but what I love the most is the rapid pace and the ability to make a positive impact in someone's life. I feel like every patient encounter you have, or I have, gives me the opportunity to make a positive change in someone's life. I think what's so interesting about telehealth is it really gives us a glimpse into our patient's life. What is their living condition like? Is there mold? How many people are they living with? I had a newly diagnosed diabetic, and I was able to have him go into the kitchen and start opening cabinets. And I was saying, well, instead of the white rice, you should really try to eat brown rice, or instead of the canned peaches, fresh fruit would be a better option. So having the ability with his wife there and seeing what their kitchen looked like, seeing what food they had available to them, I think is something we wouldn't have had the opportunity to do without telehealth. I really also love the ability in my position to try to innovate, to try to figure out the best and most effective ways to engage patients and what's going to have a positive impact on them, and really being able to measure the changes that we make. I love the challenges that come up in healthcare and trying to find more creative and efficient ways using technology to deal with them. So I really love what I do. I think I have a great role, just the ability to see patients and use technology. I think I'm really fortunate.
Yeah, it makes me think with the infectious disease program, a lot of times, one thing that's really important is compliance, right, to treatment.
Correct.
There could be depression, there could be difficulty with getting on site. There can be more privacy concerns. So what has been the impact of providing telehealth, for that service delivery that you're
So
involved with?
I think really the key has been enhanced access. I think they feel very comfortable that they could essentially see me 7 days a week through a telehealth visit. So a lot of time, well, especially earlier in March, April, May, they were very nervous and apprehensive to come out of the house because a lot of them have very weakened immune systems, and they were nervous to go out in public. So just having the ability to know that they could receive medical care remotely, just I think mentally made them feel much better. They just didn't have to worry about it.
Yeah, I would imagine so. Yeah, well, thank you very much, Allison. I greatly appreciate it. And
Sure.
thank you for all the work that you do. And, that sounds like the thing that you like most is the impact that you make on patients. And I'm sure that you make a very big impact on patients. So thank you very much.
You're welcome. Thank you. Nice speaking to you.